So we are in Detroit, Michigan, the city where my family is from, to look into some organizations that deal with women and mothers, and to see how their approach to maternal care is different than the approach we commonly see in the healthcare system, where Black women are dying 3 to 4 times more than white women due to pregnancy-related causes. We're just going to explore what they're doing, if they're seeing better outcomes with the women they're working with, and if they are, we're going to explore why they're seeing that difference and possibly what can make the healthcare system better. I grew up in a church in a community that was centered around this concept that God himself believes that relationship and knowing us is so important, that he himself would come down and become human and experience the things that we experience to get to know us better, and then take all those experiences and our mistakes in those experiences and die for us. And I believe it's John chapter 1 verses 11 that says he came into his own and his own received him not. And I've always thought that verse was interesting, and I think it really speaks to where Black people are in this country when we talk about the Black maternal mortality rate, that Black people have been in this country for 400 years, and yet there's such a reluctance to know us. And one thing that was beautiful about the church that I'm grateful for is this concept that no matter if your family rejected you, no matter if whoever rejected you, whoever didn't want you, we're going to create a new community based off of God wanting us, and we're going to find our purpose in that relationship. And when you think about the nature of childbirth, God didn't have to put us in wombs. He didn't have to do any of that. He could have just been like, bam, here's a baby where I want it, Kentucky, boom, in this family. Or as Danielle, who's holding the camera, pointed out before, he didn't even have to put us in families. But he literally decides to, instead of doing that, put us into a womb of a person who's been wounded, who's been broken before, who's been dropped before, who has all these experiences, but give them the opportunity to birth something beautiful. And in that person's mistakes and in that person's successes, we get to know them and they get to know us. And it's off of that relationship that we're able to grow, that we're able to breathe, that we're able to survive until labor and the baby is born. And even after that, you survive based off a relationship. And I think it's so important that we learn how to honor the purpose in people's lives and honor relationship, honor community, this idea that every single individual person has a function that's essential to a larger purpose. And I think that's so important in healthcare, that we look at people like that. So we are at this church that's around the Brightmoor area, about to talk to Tyra, who runs an organization helping teenage mothers. And we're here at City Covenant Church, where she's holding an event right now for young girls. All right. Hello, Tyra. Can you introduce yourself and say a little bit about your organization?
Okay, so I'm Tyra Moore, the founder of A Girl Like Me, Inc. I started A Girl Like Me, Inc. because at the age of 14 years old, I became a teen mom. Mm-hmm. My mom found out on a Tuesday. I gave birth in the same week on a Friday. Yeah. I always get that facial expression. And because of the huge response to my mom calling the family, friends, and the community, when we got released, we couldn't even get in the house. There were so many things. And I promised myself that one day I was going to pay it forward.
Okay,
so,
wow.
They help provide things for my baby. So like diapers, wipes, clothing, baby bed, car seat, stroller. And it like lasted for up to 2 years. I had stuff for her.
Okay, wow.
Yeah.
Wow. Could you talk a little bit more about what your organization does? Because I know you do more than just providing like diapers.
Yeah, so we provide like parenting classes with our partners near Purpose for Life. So on Tuesdays we do childbirth classes. Wednesdays we do lunch and learn. Thursday, we do parenting class. And on Saturday, I run a mentoring program for girls, teens, and teen moms up to the age of 17, where we talk about self-care, preventive pregnancy. We do CPR classes. We do everything a teenage girl should know about their bodies, healthcare, anything, we provide it and teach it.
Okay, wow. Can you tell me a little bit more about your pregnancy class, like what you teach during your pregnancy class?
So during the pregnancy class, I don't teach it, but my partner that's a social worker and she has an MIHP program.
Okay.
She comes in, she talk about like child development, safe sleep, of course. She asks questions. She play like a game to see what the moms know already and teach them things that they should know about, of course, the child development and the safe sleep.
Okay, and what do you do during the parenting class?
So during the parenting class, it's like basically the same thing, but the childbirth class is like it's something else she talks about, like breastfeeding, and also I prepare like bags for them. I get them like different little samples of different things for babies, diapers, wipes. We get them like little baby clothing and items, you know, because they're pregnant. Belly band, of course, too, to help support their back and their bellies as well.
Okay, so can you talk a little bit more about the response you've gotten? I'm trying to understand how what you've done has impacted the lives of the young girls that you're dealing with, especially considering how there's a stigma around young teenage moms and stuff like that.
Yeah, so providing these classes, especially safe sleep, showing them how to properly, you know, lay their baby down and not having extra covers, the bears and things in the bed. Also, not leaving them in car seats. I love the fact that they do have like the new car seats that doesn't have the handles, because a lot of moms do. They don't have beds, so they leave their babies in the car seats to sleep. And also with us providing like the free packing place, they have somewhere to lay their babies down. They don't have to sleep in the bed with them. So that's a good help and support, knowing that they can come somewhere and get it for free, and also learn about the safe ways to have their baby lay down and go to sleep at night.
Okay, so do you think there are a lot of resources around that help young girls in this situation know, like what you're talking about, not sleeping in the bed with the baby, a lot of the things that some people might say are common information that everybody would know? Like, do you think that there's a deficit in information?
So I kind of do, because they don't like broadcast it. It's like you really have to search for it, and it should be broadcasted more. So a lot of moms, they do have to search for it, and sometimes they have to jump through hoops to learn the information and get these items for free, which I think it should just be free. And also you should want to tell and help these parents, you know, because a lot of young parents, they don't know anything, and they need the help and that support and that village, because it takes a village to help, you know, everyone. So, yeah.
Hey, can you talk more about what you're talking about, jumping through hoops?
So to me, like, it's a lot of paperwork. It's paperwork. You gotta do this, sign this, do this, application, do that. Tell somebody else, get this, do your fingerprint, all this. And I just feel like it's just too much. Like, you know, if you want to help me, help me. You know, I don't have this. I might not have this information. Sometimes I done been to organizations where they do want extra information. If you don't have it, then it's no service. You can't be seen. And why is that? You know, I need this. If I need a baby bed, sometimes girls can't bring their kids from the hospital if they don't have a car seat. You have car seats. Help me with this car seat so I can bring my baby home. Just that simple.
Yeah, so roadblocks.
Roadblocks.
Bring their children home. That's wild.
And a lot of people say, like, well, you shouldn't have had this baby. Well, the baby is here now. Help me.
Right. Right. And that's one thing that I also wanted to touch on is I am a big believer in God. And I believe if God says that, if she's pregnant, God clearly allowed it. So if God thinks that she could be a mother, it's not really for everybody else to say, no, she's too young, no, she's too this, no, she's too that. Right, but you said we're here now. So how can we help these people progress?
That's just like with my situation. I know what I did. I shouldn't have been having sex at 14 years old. It's my first time I did get pregnant. And I did hide the pregnancy and everything, but my child is here now. What are we going to do? I know I need the help. But help me.
So can you talk about the role you feel like self-esteem plays with young girls in a healthcare setting? Because I'm trying to put myself in the mind frame of, okay, I'm a young girl. I probably feel like I messed up and I have to seek for help. But how much am I going to advocate for myself when I already feel insecure about myself? You understand what I'm saying? So like, what do you do to like disassemble that so that young girls can actually get the care that they need in the healthcare system?
Well, just having somebody, for me, I would think is having someone that been through the same thing. So that's why I try to advocate and be that voice. Because with me being that voice, a lot of girls have came out and told their story. and like young as 12 have been pregnant, you know, and scared to tell. But since I've been on the news and they've been hearing my story, I get so many phone calls every day and all day about what's going on. They're scared to tell. And I was that person. I used to get from my mom telling me my life was going to be over, nobody was going to want me, about my weight and things like that. I used to get teased by, you know, it started at home by my uncle about me being fat and this and how my body wasn't going to be the same. And my mom used to tell people, bring people up to me like I used to be smaller than her and all this stuff like that, like body shaming me. And you know, I'm at home, you're supposed to be protecting me and things like that. I used to get bullied as a kid because I was a chubby kid. That's why my family ain't know I was pregnant, because I was big. They just assume, okay, she eating regularly, so I mean, yeah, so yeah. With me, I talk to my kids. I make sure I tell them every day, like, they're beautiful. I tell my son that he's handsome. Like, you know, you are loved. You know, you have to be that support. Even with my girls in my mentoring program, I talk to them. I let them know, like, it doesn't matter about how anybody else feel about you. How you feel about you is what matters. So that's how I just express it and just be the village for others, because I've been there and I've overcame it by supporting myself. Like, no one else matters. I control my life. And that's why I let them know. So.
And what stories have you heard from young girls in the healthcare system? Do a lot of them choose to have midwives, or do they go to the hospital, have birth? What's that process like?
So what I have learned, like, recently, and just from doing the parenting classes and the childbirth classes, which I love, even when I just had an event recently, I was picking up hangers from them looking through clothing. A lot of girls have been talking to other girls about doing home water births, and I'm like, that is so interesting, and also having a midwife and being at home, the comfort of their home, as long as not no issues going on that they have to be in the hospital. I think that is wonderful.
Yeah, and I've heard a lot of conversation around medicalized birth, that birth is something that's natural. The hospital is typically a place where you go when there's something wrong with you, when you have a disease.
Of course.
So why is it that you feel like you have to go to a hospital to do something that's natural?
So that has been a talk. A lot of the moms, like majority of the moms that have came to like our programs and classes, want to try water birth or want to have like a midwife and doula as well. So I'm loving it because it's awesome. So.
Yeah, and do you support them throughout that process?
So yes, like if moms, we connect them with like doulas, because we do have a birth doula and I don't know the name. I think the afterbirth doula too as well. Come out and they speak and they actually do like classes, and also we have like the breastfeeding association. They come out because some moms are skeptical as well, and we try to get them on that right track, you know. But if they can't, you know, formula may be an option down the line. But we try to get them doing everything naturally. And they really are like up to doing it, so we just see how it goes, you know, once they get to the pregnancy and things like that. And we show them good videos and things, so, you know.
Okay, wow. So it seems like you do have a lot of prenatal and postnatal education that you do. So can you tell me a little bit more about how you even got to this point that you have the Breastfeeding Association, you have a doula program? It seems like a whole lot.
So yeah, so with that, with my partner, that she found me when I first like was really doing stuff in 2020, because that's when I really had came out, and I got my first office in like Dearborn. She had called me and asked me about some diapers. She was a social worker, and like I said, she has an MIHP program. We had just had talked and connected, and we just was sticking together and stuff like that. And she was like, why don't we start these classes? I always wanted to do it, but you know, like, I'm the only worker for my organization. Now I get volunteers here and there, but when I first started out, it was me and my husband. Like, I started off with our savings because, you know, it was the pandemic. We just wanted to help, and I knew I wanted to always do this, so I'm like, perfect time, pandemic. But we just knew we wanted to do this, so we started in 2021 doing the classes, and then we just took off from there. You know, we partnered with people, and then I wanted to put in with it, having them learn something too. So that's why I just started this year, Lunch and Learn. So like, we just did a class Wednesday on life insurance, you know, so they can know about, of course, protecting themselves and their families, and also gaining money from it too as well. So anything happen and they need to pay a bill or something, that they can get money, borrow money from the life insurance. Also, I can tell you about something else I do. So I didn't get a chance to go to my Teen Mom Prom, so last year I did my first one. I invited 25 moms, ages 17 to 100 years old, and the oldest one that came out last year was 25. So I'm doing it again this year, and I put out the applications in May, and the Pistons this year is sponsoring it. So I'm gonna have it at their facility, and I'm inviting 25 new moms, 17 to 100 years old, and that's going to be like our signature event, you know, having a prom.
Wow, congratulations. So is it going to be at the Pistons facility?
Yeah, their performance facility where they practice and things. So they have like, their court is downstairs, and upstairs they have like a nice little hall space where you can have like events, and then like on the side they have like patio where you can be outside and stuff. So yeah.
Wow,
Yeah.
Congratulations.
Thank you.
That's
Thank
awesome.
you.
That's awesome. I can appreciate that because I was a COVID grad, so you know they shut that bad boy down.
Yeah.
So
Yeah.
thank you so much.
No
Can I ask
problem.
one last question?
Yes.
Like, how are you connected to this church across the street? Are you connected to the
Yes,
church?
I am. So actually, let me see. Oh, last year, so I ended up winning a grant through Essence Magazine, and
Congratulations.
Thank you. Thank you.
The Pistons, Essence.
So they ended up flying me down, and I had to still have my community vote. So they flew me down to Essence Fest, and the goal was to win the 100K. So when they announced it, I didn't win the 100K. I had won 10K. And so my community still won. My community still had to like vote for me and things like that. So I made it as a finalist as a top 3. So the pastor of the church that owns this community center, one day we went to like a Brightmore Leaders convention, and we were sitting with each other, and he was telling me like, you know, I voted for you. And I'm like, you know, thank you. He was like, I seen what you want to do with the money. The goal was for me to get a house. I was going to buy a house. And he was telling me about a story of a house that he bought from a family. A mom had got shot up, and her baby had got shot up too, but the baby ended up dying. He was like, it was just sitting. And during the pandemic, he had some older ladies was supposed to be doing something like what I was doing, but it was the pandemic. So, you know, they was like, no, we can't do it now.
Yeah.
And he was like,
Especially
if you want to, you can use the house to run your services out of. Wow. So the house is right around the corner. So I've been there almost a year running my services out of the home. And this is his community center. I have access to this, and I can go to the church. So
yeah, wow.
Yeah.
And I think that's a big thing, because church is such a big thing in community, especially Black communities. When you look at it historically, and I think that there's a lot of things now. People are really like, you know, anti-church in a lot of ways. They don't really want to be bothered, but there still are churches that are doing great things like this, and even letting community members access it to do things for the community and do things for groups that people typically think churches are like, no, you know, like typically people talk about churches are judgmental, they don't want to be bothered with teenage girls. But here is a church that's letting you run this so you can help teenage girls. So
yes.
I think that's beautiful.
Yes.
Well, thank you for speaking with me.
No problem. Thank you.
Thank you for offering us lunch. Everybody throughout this whole entire process has been exceptionally kind for me, yanking on their time randomly.
No
so
problem.
thank you.
No problem. You have a good day. You have a good day.
Well, I care.
Hello.
Hey, how are you? Nice to meet you. Nice to meet you as well. Yeah.
All right. So could you guys please introduce yourselves and give me a general overview of what One Network is and why it was founded and what you do in One Network?
Sure. So, yeah, I'm Courtney Latimer. I'm the manager of the One Network, program manager of the One Network. So I have day-to-day oversight over the structure and function of programming, the team, some administrative responsibilities and things like that. Just try to make sure everything is running smooth on a daily basis.
And what do you do?
Yes, my name is Dr. Kimberly Dawn Wisdom, and I serve at Henry Ford Health as Senior Vice President of Community Health and Equity and the Chief Wellness and Diversity Officer. So I have the honor, literally, to lead the WIN Network, Women Inspired Neighborhood Network Detroit. We're expanding, so there's a WIN Network Cleveland.
Okay.
But just to lead and guide a team that is so overly committed, work tirelessly, work very, very hard to address the needs of women, and think of even more and more innovative ways to do that. And so whether it's a mural project that you see on the wall, maybe you can capture that,
Yeah.
you know, which is just, there's a whole really cool story behind that, or identifying ways to want to reach out more and more to women that aren't pregnant even, and we did a lot of that pre-COVID, as well as moms that are pregnant, and connecting them with a community health worker, with a certified nurse midwife, and that sort of thing. So I can describe more of the nuts and bolts of the project too.
Yeah, so why was Win Network founded?
Well, it's an interesting story. I'll try to give you the truncated version. But there were 4 CEOs that were CEOs, chief executive officers of Detroit-based hospitals, and there was a need to address infant mortality. And I was returning from serving as Surgeon General for the state of Michigan with Governor Granholm, so I had the honor of working across the entire state. And infant mortality was one of my babies, so to speak, in terms of addressing that in 11 very underserved counties. And so when coming back to Henry Ford, they knew of my interest, and they knew that I couldn't be confined to one hospital or one building or one health system, that, you know, after serving at the state level, you kind of feel like you want to address more than one small entity. So they thought it was great to charge me under the leadership of Nancy Schlichting, our then CEO, to ask me to, can you address infant mortality for our region? So here you have 4 competing hospitals coming together and saying, you know, Wisdom, would you address infant mortality across our region? And I was elated, because I wanted to work beyond the walls of one health system.
Yeah.
I wanted to really have a team that we could be transformative across a much larger footprint region.
Well, that's even gives me a little bit of hope that hospitals would even ask you to do that, because sometimes you question if hospitals are just really for-profit organizations, or if they even really care about the things that are going on with the health of communities and just where our world is in general. And this is a lot about you, that they even thought to ask you to address that. So.
Well, they, I think, were pretty forward-thinking leaders, whether it was Nancy Schlichting or her predecessor, Gail Warden, and then actually the other CEOs at the table. One of them, actually, he was Mike Duggan. He was CEO of DMC at the time. So these are forward-thinking leaders that recognize that I was also oriented toward the community in a very significant way. So it was really sort of this beautiful alignment where they wanted to see something move, and I definitely wanted to participate and lead the effort. So we established a Detroit Regional Infant Mortality Reduction Task Force. And usually task force are groups of people that kind of meet, have a task, and they're done. Well, it was clear to us that our task was going to be lifelong. I mean, we weren't going to just sort of deal with something and then, okay, we're done, we button that up. So we brought these 4 competing health systems together, community partners, community-based organizations, and academia, and sat at the table and started thinking about how can we collectively drive down infant mortality.
Yeah, this video is about maternal mortality, but I think infant mortality and maternal mortality go hand in hand, because obviously children are very important to mothers. I've been told it's a special kind of love. I don't have a baby, but that's what I've been told. And of course, mothers are very important to the health and well-being of children. Can you talk a little bit about what you've seen specifically in the Black community as it relates to your work in infant mortality, and why you did it in Detroit? Because I know you said several counties at the time were having issues with infant mortality, and talk about that a little bit.
So Detroit had one of the highest infant mortality rates in the state and in the country, and that infant mortality rate had been high for quite some time. And many people have done really great work, Vern Davis Anthony, others, to try to drive it down, but then it would creep back up after that intervention was over. So we felt as though if we could design something, and this is where Courtney and Jay and the team was really involved, and our community health workers in being really innovative in this space. But if we could design something that would be, if it could work well in Detroit, it could work well anywhere. Because, you know, just watch the news or any, you know, challenges that happen. They're like, well, here's Detroit. Here's, you know, here are the statistics about it. It's like, why are you looking at Detroit? I mean, you know, so we do have our challenges, but the beauty of it is that if it works well, which it has in a city like Detroit, it could work in Atlanta, it could work in Philadelphia, it could work in Cleveland, it could work in, you know, many other, Atlanta, many other cities that are very similar in terms of the urban dynamic. It could work in Detroit. If it plays well in Detroit, it could play well anywhere, right?
Yeah, that's really cool. I saw on your website that it said, I believe 30% of Black and Hispanic women feel like they were treated poorly by their healthcare provider because of a difference in opinion they had with the provider about their labor and their pregnancy. Why do you think that Black women specifically are having this issue, and what do you think the root of the issue is?
Well, Courtney, you want to start to address that? Because she is the one that's working really, really closely with, you know, and hearing what the women are saying, our women in our program.
Yeah, I think one of the reasons that that women of color are receiving this type of treatment or having these experiences just comes down to a lack of respectful care. Mm-hmm. We talk about a lot. We at Henry Ford, we provide unconscious bias training called Ruby, reducing unconscious bias and initiative training to our women's health team, as well as other physician partners throughout the state of Michigan. And the purpose is to teach providers about the importance of listening to your patients and the importance of respectful care. Whereas if this patient is telling you that this is what's going on with their body, trust that they know what's going on with their own body, and let's figure out how we can get these things handled together, and not just assume that because you are the provider that you know best, that you want better for this patient than what they want for themselves and their babies. And so I really think it boils down to a lack of that type of training. Previously, I think in the past, there wasn't a big focus on why it's important to respect your patients, especially a woman who's bringing life into the world, why it's so important to listen to what they're saying and to be a little more empathetic, as opposed to always being in work mode. I think it's important to put yourselves in the shoes of your patients as a provider sometimes. When you have patients that are having challenges or barriers, if this patient can't come to the doctor, it's not necessarily because she doesn't want to. It's because sometimes she can't. Maybe she doesn't have transportation or a babysitter or whatever. So extremely important, and I think that's why that experience has been the way it is, because of the lack of focus on things outside of the procedural portion of being a clinician. You know, there's a human. You're dealing with a whole person, not just a patient. And so we try our hardest here at Henry Ford to make sure that our clinicians in women's health are properly trained and have that focus on respectful care, to make sure that our women receive amazing patient care. And in One Network, we have a specific focus on choosing the physicians and the clinicians that we work with and the midwives that we work with based on their passion and their ability to, you know, properly care for and respect our patients. So, like I was talking to you about earlier, it's sometimes difficult to navigate the resources in the Metro Detroit area because there's so many. It's so fragmented that a mother can get or a family can get very stressed out and feel defeated trying to navigate all those things. So here at One Network, our community health workers serve as the resource for the resources, if I can say it that way. You give a mom a CHW, the CHW talks to her about what she needs, what she desires, what her family needs, and then they work hard to try to mitigate as many barriers as they can for that mom so that she can bring a healthy baby into this world and raise a healthy baby.
So I was just going to say, even the dynamic too between the community health worker, who's just sort of that secret sauce, and the certified nurse midwives who bring that clinical perspective, the two combined in the group visit model just is a combination that's just been yielded wonderful results and has been very successful from a data standpoint, and also, you know, women have referred their sisters, their other, you know, friends to the program, and nothing better than a referral in terms of speaking of the impact that you're having on that person's life. If they want to refer and they trust you enough to refer their family members, their friends to you, that's a real testament to the work that the team has been involved in.
It is, because we all know places that we definitely won't refer.
Yeah.
I mean, you even go to a restaurant and you're like, don't ever go there. Like, so the details matter, is what I'm trying to say. And it seems like you guys really care about the details. Now, you talked about group prenatal care. Could you tell me a little bit more about what that is and why that's even important?
Sure. Core to the work is what we call the centering pregnancy model. So that was one that was developed many years ago by a woman by the name of Sharon Rising. But we have innovated on that model by including the community health workers. So the centering model is where 8 to 12 women will meet together as a group for 2 hours. So the traditional prenatal visit, you might have 5, 10, maybe 15 minutes with your provider, and they're doing all the belly time as well as answering any of your questions. But typically there's not sufficient time to really go in deeply into education or answer their questions even sufficiently. So with this group model, they actually meet for 2 hours at a time for per month for the first several sessions, and then closer to the time of delivery, then those sessions become every 2 weeks, much closer. But for 2 hours, there's belly time, of course, about a half an hour belly time, and then an hour and a half where they sit actually in a circle, and that's why these chairs are designed as they are, because this is actually the space where the women sit.
Oh.
This is the space. So the team actually ordered furniture that would actually fit. You've got to be in a circle. So the facilitators, the certified nurse midwife and the community health worker, both facilitate the session, but all the women sit. It's kind of like King Arthur's Round Table, where yes, expertise comes from the certified nurse midwife and the community health worker, but expertise also comes from around the table or around the room, because some of these women, this is their second, third, fourth pregnancy, they are experts in many respects on how to navigate through a pregnancy well, successfully. So everyone at some level is an expert, and then if there's any misinformation shared, the certified nurse midwife or the community health worker can say, well, let's talk about that a little bit more, and maybe adjust some of what they may say, but they get a tremendous amount of information because they learn from each other as well as from the experts.
Yeah, and that helps everybody feel valued. I think that's so important too. And even what you were saying about sort of humanizing patients, and that everybody has something that they can contribute. And I think a lot of times in healthcare, I've even been taught in school that the patient is the expert on what's going on in their body. That we forget that so many times because education sometimes, I think, we can allow it to pollute our minds and make you think, oh, I know everything because I read one chapter in a textbook, when that's not accurate. So on your patient website, not your patient website, on your just general website, you have a lot of patient testimonials, a lot of videos about different things to the community. I saw you're specifically connected to Osborne community as well as Brightmoor, and just a lot of different things that you do. But is there a reason why you have so many testimonials on your website besides just showing the results of your work?
Well, I'll start off. It's so important that we are very intentional about trying to capture the stories when we can, because some of these stories are very powerful. I think of the April and Ava, the woman that had 3 preterm births, low birth weight babies, and then ultimately her 4th pregnancy, which was with Wynn. She had a full-term baby and didn't realize she could have a full-term baby.
Wow.
So we have to capture these stories because, I mean, sometimes people think it's incredible. Like, are we making up this story? Well, it's better hearing it from them. I mean, they are the data too. We can have all the numbers, but it sort of brings the data to life when these women can tell their own stories and the impact WIN has had on them. So we try to capture as many as we can. Of course, we're so busy delivering programming. The capturing the stories is another whole endeavor. But if we can have these women tell their own stories, the narrative is powerful. And we know that storytelling is key, whether it's convincing other people to join, whether it's convincing funders to fund the effort, whether it's convincing women to join the program. If they can go on the website and see, oh, this woman looks like me, this could be me, and can relate in that respect, and then say, I want to join because of those testimonials, that's very powerful.
Wow, and I think that's really important, especially what you said, somebody who looks like they come from a similar background. Even I've noticed a lot of times when I'm learning about OB, or I just had my OB rotation, but it's more from the perspective that every woman has a loving husband, and they're this great family. They got a golden retriever that's never bit anyone in their lives.
Golden retriever, that's right.
Yeah. And they're coming in here and they're going to have this beautiful pregnancy. When that wasn't my background. Again, I've never given birth. I'm just talking about my home background, and that wasn't most women I know their home background. And sometimes I think when people hear that and learn about that, they can sometimes, if they come from that background, be taken off guard when they meet a woman who doesn't have any support when they get in the room, or a woman who doesn't have a lot of financial resources around her, and all of those different things. So I do think it's really important that we humanize those people too, and say, okay, sit around the table, they still have something to offer, even if they're coming from the situation, because I'm a big believer that situations don't define who you are. So that's really important. And on the topic of support, I see that you guys have, I believe, WIN Fatherhood. It says we're in this together, which I love. But could you talk more about why you guys have that, and like why you think that's important, instead of just, general support your friends in the room, but what's the importance of having the guy that got you pregnant in the room?
So I can start with that one. I think when we started in 2016, the Centering Pregnancy model calls for the mom and a support person to join group. And so what we noticed as we continued to go throughout the year, 2016, 17, 18, we said, wow, there is an overwhelming amount of fathers attending groups with these moms. Fathers that looked like our fathers, that looked like our brothers. We are like, this is our community coming together to make sure that these babies are being born healthy. And so we wanted to make sure that we had a concerted, focused effort on being inclusive of the fathers, because if they're here, we need to speak to them, because that's the support person. When mom is in labor, when her vision is cloudy, when she can't remember what the provider told her, dad, if he's the one that's here, he's gonna be the one he's gonna be her voice. He's gonna advocate for her. So that's the person that we need to talk to. And we also need to let him know that you're important in this. You are a part of this family dynamic. This doesn't work. If you're here, this doesn't work without you. So let's value dad. He's here, he showed up. He's not just here though. Our fathers participate. Like WIN Network dads, they participate. They want to tell the provider, they want to tell the midwife, I told her not to eat that. I told her she's not supposed to be drinking that. I tried to tell her. They want to help with breastfeeding. They want to learn how to change diapers. They want to put the diaper bag together. They want to make sure that they are knowledgeable in this baby, especially fathers that are here for having babies for the first time. So we want to be very intentional about making sure that we capitalize on the opportunity to be able to be inclusive and show fathers that it's not just mom having the baby. The family dynamic is extremely important. And we wanted to make sure that anybody who came to WIN Network felt like we valued fathers as well.
Yeah.
Exactly. And what's great about what Courtney said is it dispels the myth that there are these dads out there that don't care. There are a lot of dads that want to know how to care for the baby. They want to know how to better care for their significant other. and it takes away that whole piece that they don't care.
Yeah.
They want to learn, they want to know. So by just seeing them show up, it was clear that they wanted to be a part of this baby's life.
Mm-hmm.
And I think probably while we haven't measured it scientifically at this point, the bonding, if you could start bonding with that baby even before the baby's born in a very significant way, and feeling empowered, like I can do stuff. I can help my, woman who's pregnant now, whether it's your wife or not, but also I can help with feeding. I don't have to be afraid. I can be a key part of the bonding experience, and then move forward. Not like the dad that sits over there. We'll call you when the baby's, walking, or 4 or 5 when we need you. No, dad needs to be. Dad can be and dad can do so much in so many ways in that bonding experience. So we were just pleasantly surprised and delighted that, look, these dads show up, and that becomes part of our data, because even in the 321 women that have been born in this, babies born in this cohort, what about 230 something dads showed up. I mean, these are dads that, not 231 cumulative, these are, mutually exclusive experiences where these fathers show up.
Yeah.
And that's powerful.
That's powerful for other women to see.
Consistently showing up.
It is. And I bet some women will invite the baby's dad when they see other women have, you don't have to have a woman as your, sole support system or your primary support system. You can have the baby's dad.
Yeah.
That's fine, So it's pretty cool.
And we have our breastfeeding rate is higher in Win Network than it is throughout the system for women of the same demographic. And so we like to give that credit to the support that they receive from the CHWs, but also we've said that when you have a family dynamic where there's somebody else who can help you and empower you to breastfeed when things aren't necessarily going the way that you thought they would go. Once you get home in the hospital, you got a nurse there, you got a consultant, you got all these people coming in, Mom, let me help you with the baby, and then we get home, it's just you, baby, and dad. But if dad has been properly educated on, okay, babe, do you feel engorged? He knows the vocabulary, he knows technique, he knows who to call if something goes wrong. He can absolutely contribute to moms being able to breastfeed I was able to breastfeed for 13 months because my husband was knowledgeable about breastfeeding, and because at times he would say, make sure you're pumping, because if you ever need to get away, I can feed the baby. So that's right. Those are things that,
that's sweet.
The type of support that you need to sometimes prevent postpartum depression. You know what I mean? So we talk about maternal mortality, knowing signs and symptoms when something isn't right, when bleeding isn't right. Like, those are all things that your support partner / dad can help with to make sure that mom and baby survive and thrive for that first year.
Gotcha. And there was a page on your website dedicated to young women. I wanted to ask you guys about your experience with young women and why you thought that was important enough to make that a main thing on your webpage.
Well, I'll start off. Certainly, we call it fabulous, young, and inspired. Yeah. This is pre-COVID, so memory is coming back. But we know, too, the science, the data show that when moms are, or women are healthy prior to pregnancy, the likelihood of them having a more successful outcome for that pregnancy is greater. So if blood pressure is controlled, if weight is controlled, and that, so wanting to reach out to women of reproductive age, knowing that the likelihood of them becoming pregnant is great. Let's ensure that your body is in the best shape, that you're as healthy as possible, because then we don't have to worry about what we call preeclampsia, eclampsia, when there's high blood pressure and seizures, and can result in a bad outcome for mom in terms of maternal mortality, if women are healthy at the onset. So that's why reaching out to them early on is important, even before they're thinking about even, having a baby, that they are at their best health possible. Because we know pregnancy, you're gonna gain weight, you're gonna, things are gonna change. But if you're at your, your healthiest prior to pregnancy, then the likelihood of having a successful pregnancy is increased.
Yeah. That's really important, especially when you're talking about a city with a lot of corner stores, a lot of unhealthy resources. I think it was, and this is not a diss on Tahitian Treat, because I do like Tahitian Treat, but one day I decided to read the back of Tahitian Treat, and I was like, oh my goodness, Tahitian Treat is not a treat at all. Tahitian Treat is trying to kill us. But yeah, I think that's really important. And your organization seems like it prioritizes a lot of patient populations that are typically not prioritized. And in the context of America as a whole, oftentimes I think that Black people and Black women are not typically made a priority, even in the homes sometimes. And so I wanted to ask you how you see your patients respond. A demographic that's typically not prioritized, to your respectful care, to your making them a priority, to your caring about them in the way that you do. So yeah.
Sure. I just want to make a few comments and have Courtney respond to that. But I think, and Courtney even mentioned the unconscious bias training and that sort of thing. The historical perspective around women, especially in OB settings, has not been very favorable for Black women. I mean, they were part of experimentation. The skin, it was felt that Black individuals' skin was thicker, so they don't feel as much pain.
The skin is thicker, wow.
Yeah, that's
exactly. So they don't receive as much anesthesia, that they don't know that much about their bodies, so just discount what they, so even there was a study with medical students that some of these, myths are perpetuated, and still, maybe in the last 10 years, medical students were believing this. And sometimes those myths are not dispelled even in a medical setting. So you come into an experience with a mom with a mindset that's very it's incorrect, but it's also inappropriate. So, but it came from somewhere, and it came from those historical places where, there was experimentation. There were women were given were sterilized with them not knowing they were being sterilized. The Mississippi appendectomy, they call it. So there's a lot of history that people don't know about. I'm talking about Black, white. People don't know about that history, but that history translates into some of the behaviors and that we see today. So that's why it's so important for us to ensure that these women feel affirmed and valued. And I'll turn it over to Courtney to say, what we kind of do with the community health workers and that sort of thing, and to help them feel they are, not 2/3 of a human, because they weren't even considered a full human. They are a full valued person, and especially if you're carrying human life or have the ability to carry human life, that's huge. And we try to get away from a lot of judgment. If you're a pregnant mom, whether you're married or not, or that is, we want you to have a healthy, safe pregnancy. We want you to birth space appropriately and know your body, and just be healthy, not only physically, but healthy emotionally. And I know many of the community health workers help to put them on a career track. They want to go into nursing, or just help the whole woman, this holistic approach, and that they're valuable.
Yeah, here at Win Network, we're very intentional about the community health workers and the people that we hire. Very intentional about their experience as a community health worker. The definition is a lay person who is a part of the community that they serve, or have a close connection to the community that they serve. So very intentional about making sure that we have women of color serving our patients, mothers serving our patients. We have a CHW who had a CHW when she was pregnant. And so these are women that live in the communities that they serve. They know the resources that they serve. They're a part of these community organizations that they're referring, and they actually care. Like our CHWs have gone above and beyond to help. They're not just on the clock from 9 to 5 and then go home. I have to tell them,
Yes.
listen, set
Yes.
boundaries.
Yes.
That's a part of my job is, listen, I know you want to help. I know you want to help. I love you for that. But you have to set boundaries. You cannot burn yourself out. And setting boundaries doesn't mean we can't help. But that's the type of people that we are. The type of people I have to tell to go on vacation. The type of people I have to tell don't answer your phone after 7:30. And it's okay to give your moms office hours, or tell them don't call me after 7:30 or I'll get back with you. It's okay to wait 24 hours to check your email if you're overwhelmed. But that's the type of community that we have serving our own communities. I'm a part of the community that I serve. I feel very connected to the women that come through this door to have group prenatal care. You know, and I'm intentional about when I meet them, letting them know that it doesn't matter what my badge says or what position I'm in here at Henry Ford. I'm just like you. I get it.
Yeah.
I had a baby just like you, and as far as maternal mortality goes, it doesn't matter how many degrees I have. It doesn't discriminate. I'm actually more likely to die giving birth to a child than a white woman who has only a high school diploma. And so it's very important to me to make sure that as a part of the leadership team that I connect with the women and let them know that not only are the people that are here with you every day working for you, we are behind the scenes working for you as well. You don't have to feel intimidated or disconnected. If you need to call me, you can. If you need to call one of them, you can. But those are the type of people that you see Dr. Wisdom. This is our leadership, and so we learn from her, and we get the okay from her, and we get she's such an advocate for this work and for these women that she does whatever she can, talk to whoever she needs to talk to in whatever room, to make sure that we have the funding that we need, to make sure that we have the recognition that we need, to make sure that we have the support that we need to continue supporting these women. And so from the top down, we just have an extremely supportive group of people working on behalf of our community. And it's absolutely amazing, and I think that the women can recognize it.
Yeah, and I can even attest to that, because I was telling Miss Cordy before you got here, I wasn't expecting a response back, especially as a college student. Like, this is a project that I'm doing. I'm going to email this organization affiliated with Henry Ford, where they probably get millions of emails a day if they'll do something for a 20-year-old college student. And you guys responded, I think, within the day, if not the next day, and said that the founder was going to be there. And then I was like, wow. And then when I read your rap sheet, when I looked you up on Google, I was really like, wow. And then when I met you and you were nice with that rap sheet, I was really like, wow. So you can tell that you guys really care about the work that you do, and that you see yourself in the people that you care for, and that what you said, I'm just like you.
Yeah.
That you would be willing to do this, or even the work that you're doing, you have to be a person like that.
And
The nature of the work is.
Also can relate to you as a young person trying to get things done. It's extremely important that we recognize that this is the work that you're doing, because this is going to add to our mission, right? And it's also going to add to you possibly being able to choose what you want to do and where you want to go in this space. And so anytime that we can support young people that want to do this type of work, even want to learn about this type of work and get the word out there, we will.
Yeah, I appreciate that. I wanted to end with asking you a question about a quote. I don't want to misquote you, so I'm going to read it. Making sure women are empowered and feel strong and feel capable of changing your community because you can. Why do you feel that women don't feel capable of changing their community?
Well, I want them to feel empowered is a really key word there, because empowerment, I think about as having the knowledge, the skills, and the resources where possible to change not only their health and well-being, but also to change the community. So actually, if you look at the WIN logo, when we did focus groups with the women, they actually, in many respects, told us that they felt like they were keepers of the community, that they didn't quite feel like they could change it, but they were keepers of the community belonged to them. And that's why we put that cityscape of Detroit in the woman's belly.
Oh, wow.
Because she's a keeper of the community. So we want her to also feel empowered. Not only are you a keeper of the community, but you can transform the community. For one, by having a healthy pregnancy. By two, spreading the word to others about how to have a healthy pregnancy. And then as you get on your feet and your children are at an age, maybe you can come back and contribute to this effort, because it's called Win Network Detroit. It's a network. It's a sisterhood. And you never graduate out of it, you never leave out of it, even after you have your baby. And I'm sure the community health workers are following some of these women long after that 1 year that they're supposed to follow the woman. They've developed relationships. And we think about it as building the community from the inside out. So having them feel empowered and valued. So the experience is just not about having a healthy baby and a healthy mom. The experience is about how we can transform. I mean, that's core to this work. If you are a different person, not just because of the baby, but you're a different person having left that pregnancy experience than you were when you entered it, we've done a good part of our job. Because we want you to go forward, whether you have any more children or not, but to feel like you have value and you can go forward because the WIN folks said so, and I believe them. And their actions indicated that I had value, because they pick up the phone, they respond. And then to hear that even the impact that you may have experienced, just thinking that we do try to respond to the millions of requests that we get. We're waiting for the few others to know, but because this is community and you're part of the community. So it's like, we still want to be as responsive as possible, because you can help share our message and maybe recruit some more people, but then hopefully you'll have an experience that you'll say, wow, I see things a little differently maybe now. Or I see things at a deeper level, or I see the impact that an idea can have, even with competing organizations, an idea and how bringing a great team of people together, you can truly begin to move into that transformation space. And I think that's ultimately where we striving to be.
Wow, that was a beautiful response. Yeah, that's so important that we're all a piece again of a building community that should be striving for greater, and that is striving for greater. And even with you all doing this work, what you said about fathers and young women, people want change. People want their communities to be better. And I think a lot of times, sometimes the news portrays this idea that, Black people are just living in these communities where people are getting shot all day and there's nothing positive and we're all just chilling.
That's right.
Woo, life sucks. We're chilling, everybody want to change. But that's actually not the truth.
Not the truth.
And people want change. People want better. Even people, whatever situation you're in, whether you consider it good, bad, mild, whatever sauce flavor you consider it to be, people still want it to get better, and people still want to do better, and especially somebody who's bringing life into the world.
Absolutely.
You're typically talking about somebody who, it takes guts to carry another life that is going to represent you when you're not here, most likely. And you're going to cultivate this being and teach them, and so it's so important how we view these women, because having a child, even though it happens every day, it's not an everyday thing, if you get what I'm saying. It's a really big thing. So I think that's really beautiful about what you're saying about community and how people want to change their community and how labor is so important in the concept of changing the community. So
I just want to add one other thing to your point that you made me think of, is that we had an intern 10 years ago. And well, the information's been embargoed. You'll hear about the press release any moment. But this intern 10 years ago spent time with Courtney J, the team, and was so impressed that here now she's working for a foundation, and wanted us to apply for funding through her foundation, and we were successfully funded. A pretty large sum of money.
Congratulations.
Yeah. So it just shows that we were trying to help people get through their educational programs and that sort of thing by spending internship time with us. having no idea that we would influence somebody that could turn around 10 years later.
Yeah.
So we're looking for 10 years. You got 10 years. Okay?
Yeah.
So when you become very famous and that, don't forget about us.
Thank you, I won't.
Come back and say, remember we did that interview way back when? Well, here's.
We'll give you some money.
That's right.
Yeah,
But,
well.
you know, we had no idea, but we were just trying to build community in every possible way we could think of.
Yeah, well, you know, the Bible says your gift makes room for you. And so the gift that you're giving definitely made room for you, and that aspect for a gift to be given. I feel like I'm using the word gift way too much, but it's fitting in what I'm saying.
Yeah.
Yeah. Win Network, I feel like I won. So thank you so much.
You're very welcome.
Thank you.
What do you think about yesterday?
I think it was really interesting. One thing that when the camera was off that we talked about was actually in all the years that Win Network has been working, they haven't lost one mother and they've only lost one baby, unfortunately, due to a parent rolling over on the baby while they were sleeping.
Yeah.
And they said even after that they really regrouped because they're all mothers and talked about, you know, better education points and what they can do to prevent that from happening. But I think that really speaks to what can happen when we care for our patients and when we start humanizing them.
Yeah.
Is we see results that unfortunately we don't see in the modern healthcare system. Now we are going to Birth Detroit, which is another lovely organization that works with Black mothers giving birth. And so we're going to talk to them. They're actually throwing an event because this week is Black Maternal Health Week. And so I'm excited to see the event, excited to see what they're going to have to say. It's going to be fun stuff. So can you tell me a little bit about Birth Detroit and how it got founded? Oh, I'm so sorry. Could you introduce yourself first?
My name is Alon Jafar. I am one of the co-founders. I worked in public health for a number of years and just recently went into retirement as a birth doula.
Okay, wow, you went into retirement already? I would love to go into retirement looking like you. Yeah, so what, like, can you tell me what Birth Detroit is about and like why it was founded?
Yeah, so the 4 co-founders, 2 are midwives, and 2 of us were working in public health with a focus, a passion for Black women because Black women have, for a long time, too long, experienced disparity or difference in health outcomes, not just during pregnancy or what we would call the perinatal time, so preconception, pregnancy, and birth, and postpartum, but other aspects of our health. So we all kind of came together with our different passions, our different experiences, our different lanes of influence, and said that Detroit deserves a birth center. But we first asked the community, do you want one? And they resoundingly said yes. So we moved into action, and as soon as we started moving to build a birth center, COVID hit. And so people were saying, where do I go for prenatal care? And so we had to open up a clinic because health spaces like hospitals were more opportunity for people who were healthy to be exposed to COVID-19. So we created a prenatal space where a pregnant person could bring their partner with them, and it was right in the neighborhood, and it still is. And that's what people want, people deserve, and people are getting wonderful care.
Thank you. You said you have who are your other co-founders?
So Charlotte Snow, who is a certified nurse midwife, Nicole White, who is a certified professional midwife. She works in the community. And then Leslie Welsh, who is our public health business person. So all kind of came together with our respective perspectives and knowledge to create what has been blooming and evolving since about 2018.
Gotcha, and I heard that you guys are the first birth center in
We will be the first freestanding birth center in Detroit, Black-led, Black-owned.
Okay.
And that's significant. That's significant in the history of this city. That's significant for the health of Black families in this city. And we're excited to have an amazing, exemplar, excellent team who is leading our care here.
Thank you. And could you tell me a little bit more about this event?
So you are here at the second State of Birth Justice convening. This is an opportunity for what in public health we call stakeholders, people who have skin in the game. So that's parents, that's providers, that's other perinatal professionals, families, organizers come together to talk about and name the policies that support the sustainability of the health dream that we know we deserve and we want. So last year we asked people, what would you want to see birth justice legislation look like? What would you want to see policy look like? This year we get to bring them back together to update them on where their dreams are and how we help move power together.
Wow. Thank you.
You're welcome.
Great being here. Thank you so much for
I'm
talking.
glad you did. Thanks for being here.
Yeah, I think it's really nice that you said parents are stakeholders, that you included everybody as stakeholders, not just the people who are legislators or have degrees, but that everybody is a stakeholder.
The experts are the ones who hold the wisdom, are the people who are living the experience. That's what we do. Let's do it.
Thank you so much. So could you introduce yourself and give an overview of like why you joined Birth Detroit?
Yes, my name is Ellie Broomfield, and I'm a certified nurse midwife with Birth Detroit. And I chose to join Birth Detroit because I believe in their vision, I believe in their passion, and I feel like their values align with what I believe healthcare and prenatal care should be.
Okay, so can you describe some of those values for me?
So the values are empowering women, compassionate care, justice, things like that I feel are very important. So I always believe in being partners with women in their care. I'm never one that's going to tell them what to do. We're going to say, this is what options we have, these are the risks, these are the benefits, and how would you go, what would you like to do? And then, make recommendations when necessary.
Okay, so you're talking about empowering women. I don't want to quote you incorrectly, so I did look up a video of something you said on your Henry Ford's overview, but you said, I'm passionate about empowering women to become partners in their care. Can you tell me why do you think women have to be empowered to do something like that? Most people would think that's the instinct of a mother, that you want to be partners in their care. So why do you think women are the problem with that?
Because sometimes with healthcare and things that you're not comfortable with or know about, you can become so disheartened by or so disempowered by that you I don't know what to do. They told me to go do this. I don't know where to start. I don't know what to do. But I believe in empowering women because then they become advocates, and then when you become advocate for yourself, when you learn more, you're more likely to stand up for yourself. So I think that's very important when you stand up for yourself, when you know what's going on with your health, and you understand to the root what's going on with you, you're more likely to make better decisions. So a lot of the times when people go to their visit, they're just like, oh, go do this, but they don't understand why. So it's important to understand why we're doing what we're doing, so that way you understand the importance of getting what needs to be done. And then when women are empowered, they empower the whole family. Women are like the foundation of the family. So when a woman's empowered to do something better for herself and for her kids, the whole family benefits.
And can you talk a little bit more about midwifery in terms of community? I know that midwifery is different than being an OB/GYN, different than what we see in the traditionalized medical system, so much so that I've heard doctors sometimes don't like midwives or discourage midwifery, which is interesting to me. So why does Birth Detroit have such a large midwifery staff? And can you just talk a little bit more?
Yeah, so midwife means with women, and right now Birth Detroit we have 3 midwives: Charlotte Snow, myself, and Angela Foster.
Okay.
So it means with women. So we're literally with women throughout their lifespan, anywhere from the beginning of puberty all the way up to menopause. Pregnancy is just a short period of the journey that we're with women. So our biggest thing is listening to women, because how often do we have our intuition telling us something that we don't listen to? You know? So when a mom tells me something, I'm listening to her. I'm with her. I'm helping her, navigate the life processes that they go through in regards to their body. So that's very important, being with women throughout the entire journey. I'm sorry, I don't know if that answered your question.
No, that did. That answered my question. And my last one is just, what do you want the future to look like for Black women in the birth industry?
I want every Black woman to have a midwife and a doula.
Okay.
And if they aren't, so midwives are primarily take care of low risk women. So if a woman is high risk, I still want her to have the ability to have access to a midwife, as well as if they need a physician, then great, let's get a physician as well. But if you are low risk and normal and you don't need physician care, every woman should have a midwife, whether they're high risk or not, and a doula. That's what my one wish is for every single woman, and that they become partners in their care. They seek to learn what is going on and truly understand what's going on with their body. Because when you understand, you realize the importance of why you do certain things to make you healthy and keep you healthy. So I think that's the biggest thing, is learning and knowing what's good for you and your body.
Yeah, education is power.
Education every day.
It's always important, always key.
Yep.
There's something that's sometimes not as accessible in our community. Looking at our public school systems, but it's still accessible.
But we got a wealth of ways to find education, right? It's just tapping into those resources. Right. So this is a great start. You doing this interview, so I'm super proud of you for doing this interview. Thank you for this, because just putting it out there, somebody's gonna say, "Oh, I've never heard of this. What is this?"
Yeah.
And then that just starts that whole cascade. So kudos to you.
Yeah, thank you. Kudos to you guys. It's a huge resource. I've done thus far has made me excited for Detroit's future, because I've learned that it's really not that hard to jump into people's lives. All 3 of the organizations that I spoke to are so passionate about their work that they were willing to speak to me. Basically no one, just randomly emailing them about a college project that I was doing, and they are so passionate about their patients that they wanted other people to see the video. So I'm not just excited for Detroit's future, but I'm excited for this country's future. I'm excited for the future of maternal care, because I've learned that whether it's starting a nonprofit, starting a for-profit business, or just changing the healthcare system from within, there is so much that we can do. And I've learned that healthcare, oftentimes we need to step outside of the textbook and step into reality, step into patients' lives, step into their stories, step into their community, and learn what it is that makes them them, even if we'll never understand it, and to see ourselves in them. Again, every single organization that I talked to made it a point that they see themselves in their patients, and that's a beautiful thing to me. So I'm excited because the story is continuing, and I thank God that the story is continuing with us.